Awesome. Thank you, Mark. I have the pleasure today to welcome you all to Executive Women's Day. And here we are in this incredible weather. What do you think about it? We were all prepared today with our Travel and Leisure fans for you because we remember last year was quite hot. We even had this giant fan back here. I won't call it by name. We were ready for the hot weather today, but here we are in this wonderful, beautiful Greensboro weather. So appreciate getting the opportunity to welcome you all today, and especially also want to mention all of our team members back on Zoom. Hello, everybody on Zoom. We've got a lot of our Wyndham Hotels and Resorts associates, as well as our Travel and Leisure associates, coming to us from across the country today on Zoom, as well as some internationally. So welcome. I also want to take just a minute and welcome you all in the room today. Today we have an incredible group that we've assembled. We've got elected officials here today. We've got leaders from various industries around the Triad area. And we also have, of course, our own Travel and Leisure team, as well as Wyndham Hotels and Resorts. So we have a powerhouse group of women here today and some men as well, which we welcome. I'm so glad you all are here, and I hope you take some time to not just listen to our great speakers today, but also take some time to connect with each other during the breaks and during lunch. We have a great lineup of content today. We're all focused on leading from the heart. It's all about the heart today, and thank you for wearing your red. You all look beautiful. Since heart is our central theme today, I just wanted to share for a minute that heart is something that's very special to Travel and Leisure Co. When we first established our company, HEART was the acronym that we chose for our values. Our values are hospitality, engagement, accountability, respect, and teamwork. So we talk about HEART a lot. Our mission is to put the world on vacation. And I know you guys are ready for that, right? If you haven't taken one already this summer, please go on vacation. But we're all about putting the world on vacation. And we're guided by our Hospitality with Heart service commitment. Our teams in the field that are out in our resorts are all about giving that Hospitality with Heart service to all of our customers. So that's our philosophy, and it ties nicely with what we're doing today. So I'm glad to be here with you today and to focus on heart health and well-being. Well-being is something that we're also very focused on as a company and that we continue to focus on. And I want to say that I really miss my counterpart. She's not here today, Monica Melanson, who is our Chief Human Resources Officer for Wyndham Hotels and Resorts. She was not able to make it today. Normally she's here co-hosting a lot of the events. We do some great philanthropic work here, and she's usually here co-leading with me. So I want to say a shout out to Monica because I think she's on Zoom today. So let's begin. I want to welcome Dr. Mary J. Cagle. She's the CEO of Cone Health, which I know Mark mentioned, and she's going to introduce our keynote speaker today. Dr. Cagle, though, is the first woman and first physician to lead Cone Health, and in 2021, she was named one of modern healthcare's 10 women leaders to watch. She joined Cone Health in 2011 and has been instrumental in leading Cone Health's national recognition of quality of care. An accomplished physician, Dr. Cagle earned a spot on Modern Healthcare's list of 50 most influential clinical executives for 2023 and was named a 2022 Power Player and a 2023 C-Suite Award winner by the Triad Business Journal. And she has many other accolades as well. So with that, I'd like Dr. Cagle to come on stage and take it from here.
Good morning. You guys look great. I mean, I love being in a room full of powerful women. I can just feel it up here. You guys, thanks. Thanks for coming out today and being here for an important day where we are talking about women being at the heart of the matter, right? We're talking about leading from the heart. And I know that's what you guys do every day. I know, just because I work with many women just like all of you, that you guys have many jobs, right? You have the job that you get your paycheck for, right? The leadership that you do in the companies that you're representing today. And then I look across the room and I know there are mothers and wives and sisters and daughters and aunts and friends, and you're caretakers for your parents, right? Many of you, as well as caretakers for your children. You're involved in community philanthropy. Many of you voluntarily sit on boards in your communities. And if I looked at the list of all the things you did, that resume would be quite long, of the things that you fill your hours with day after day. In fact, I often wonder how the world would function if it weren't for women who've committed themselves to things they believe in, right? So I'm really thankful for all of you and the many women just like you all throughout our community. And that's why we've chosen the topic we've chosen today, because it's really important for you to take care of yourselves. And often we don't. Often we're last on our list of things to care for. That's why we're talking about women's heart health today. So Cone Health is nationally recognized for our high-quality heart care. Our Heart and Vascular Center is one of the nation's top 50 heart hospitals in the country, top 50. And it has been for multiple years. And that's at a hospital that is the #1 hospital in all of North Carolina. For the second year in a row. I'm just a little proud of that bunch of people. So we come to you with some knowledge and authority on this topic. And it's important because do you know that heart disease is the #1 killer of women? The #1 killer of women. 1 in 3 women will be affected by heart disease. So look at your table, look at yourself and the person on each side of you. Statistically, one of you will be affected by heart disease. That's sobering information. And I would tell you that we know at Cone Health that we are really good at taking care of you if you develop heart disease. We're really good if you get a heart attack of saving your life. But the real value is in preventing that in the first place. And so that's what we really want to talk to you about. Because as much as we know we can treat you if you come to us with heart disease, we want to talk to you about how do you keep from going down that road in the first place. We'd rather keep you healthy and keep you doing all the great things you do in our community every day. So to that end, I'm delighted to present our keynote speaker today. And then you're going to get to meet a whole great team that works on that every day later after lunch. But today I want to introduce first Dr. Tiffany Randolph. Dr. Randolph is a homegrown expert. Her undergraduate degree is from Wake Forest University. Then she went to medical school at Harvard University and then came back to train for her residency and her fellowship in cardiology at Duke. Oh, and then by the way, in the midst of all of that, she got a master's in healthcare administration at the University of North Carolina at Chapel Hill. She is very interested in hypertension. and especially the identification and treatment of hypertension. And to that end, she's the founder and director of our Advanced Hypertension Clinic at Cone Health. She's been named by the Triad Business Journal in their 40 Under 40. She's a member of the Greensboro Medical Society, the Old North State Medical Society. She's on the board of the North Carolina chapter of the American College of Cardiology, and she's part of the North Carolina Medical Board Review Panel. And there's a long list of other things that she does. And in her spare time, she's a mom and a wife. You guys all know that part, right? So I am delighted to present to you today Dr. Tiffany Randolph. Tiffany.
All right. Well, first of all, it's an honor and a privilege to be here, but whoever decided to put me on after Dr. Cagle, we should have some words afterwards. It really is a privilege to work for and with such a wonderful woman who leads our organization and makes sure that people like us have a seat at the table, and not only that we're there, but that our voices are heard and supported, and that we're given everything that we need to help improve the lives in our community. So I don't take it lightly that I'm standing in a room full of highly accomplished women, and we thank you for spending your time with us to learn a little bit more about how we can all keep ourselves a little bit healthier. So some might say that I'm biased, but I think that the heart is the most important organ in the body. Your heart beats about 80 beats per minute. That's 4,600 times per hour, 115,000 times a day, and over 42 million times a year. Makes me pretty tired just thinking about that. But as women, we are the heartbeat. We are the steady drum that will always get the work done without fail. Whether it's day or night, whether it's work or family or community, we get it done. But sometimes, as Dr. Cagle mentioned, that doesn't leave a lot of time for us to take care of our own hearts. In the time that we have together today, I hope that I can inspire you to lead from the heart by first caring for our own hearts, second, caring for the hearts of those in our families, and finally, but certainly not least important, caring for the hearts in our community. Now, I'm not going to give a room full of brilliant women executives the basic heart talk. You're ready for the higher level challenges. As you know, the pandemic brought many changes, and most of them were not good. Many of us fell into lifestyles that are not healthy for our hearts. I'm challenging us to a heart reset so that we can better take care of our hearts and the hearts in our communities. So what do I mean by a reset? The R, this is challenging, no knocks to the back of the room, but the R is to reduce our alcohol intake. Sorry. They're like, get her off the stage now, we're done. So did you know that many of the studies that tell us that alcohol is good for our heart are actually flawed? Now, that's not to say that there aren't some modest benefits to red wine on our hearts when drinking in moderation, but the challenge is that many people struggle with the moderation part of that. Also, the studies that said that people who abstain from alcohol are less likely to live a long life than those who drink lightly fail to mention the fact that some of those people who abstain from alcohol did so for good reason, like they had underlying medical illnesses, or they had a history of alcohol abuse. The truth is that alcohol is associated with hypertension and many cardiovascular risks, including heart failure, atrial fibrillation, heart attacks, and stroke. And that's just the effects on the heart. The pandemic only highlighted the fact that alcohol is often used as a remedy for stress and isolation, but it leads to more stress and isolation. The healthiest option is to abstain from alcohol, period. But if you can't do that, make sure that for women that we're drinking no more than 1 drink a day, or men no more than 2 drinks, and go back and educate yourself on what 1 drink is. Just because it fits in a wine glass doesn't necessarily mean that 1 drink. No judgment, no judgment. Okay. And just be careful that your intake of alcohol doesn't increase as your tolerance grows. Okay. I don't know that it gets any easier, but the E stands for eat plant-based. So many people come to clinic and they want to know, what can I do to improve my cardiovascular risk without taking meds? The best option is to eat plant-based. Now, in the most extreme version, that means being vegan. That means not eating anything that had a mother or its derivatives. So no eggs, no milk, no meat, no cheese. It can be challenging, but the rewards are there. So avoiding animal products has actually been shown to not only slow disease that's there, but to help reverse the plaque that we already have. It reduces inflammation, it lowers our weight, and it improves other cardiovascular risk factors, like lowering blood pressure, lowering the risk of developing diabetes. It also has benefits on cognition. It can slow the rate of progression of people who have Alzheimer's dementia. Now, even if you aren't ready to move to a completely plant-based diet, incorporating some meatless meals into your life can also have benefits. All right, less controversial. The S in reset stands for schedule time for yourself. Yes. So in caring for everyone else, it can be really easy to forget to make time for yourself. Many of us manage to check off every box at work. We manage to lead through every new acquisition, every new merger. We get our kids to every appointment. We make sure our aging parents get to all of their appointments, but yet we can't seem to find time to exercise, to meditate, to grow spiritually, or even just get a massage. I know personally, I sometimes feel guilty when I come home after working 13 hours and I get to my garage and I just need 5 minutes to take a deep breath before I go in and relieve the babysitter from my 3 children. I love them dearly, all of them. But how can you pour from an empty vessel? If we give ourselves the time, if we give of ourselves for the over 16 hours of every day that we're awake, surely we can be intentional about finding at least 30 minutes for ourselves and not feeling guilty about it. Whether you need prayer, meditation, exercise, time to think and reflect, a hot bath, whatever it is that fills your cup, take time and do it. This time of restoration is vital, and it will allow you to be a better leader when you return. I have to constantly remind myself that my most precious asset is my mind. And when I don't take the time to calm myself, to refuel, and to reflect, I'm doing a disservice not only to myself, but to all of the different teams that I lead throughout my life. The next E in reset stands for exercise at least 150 minutes per week. The benefits of exercise cannot be overstated. Of course, it helps with weight management. But even before you lose a pound, exercise helps to lower your blood pressure. It is the least expensive antidepressant on the market. Exercise releases endorphins that help to improve our mood, and it helps to make us make healthier life decisions throughout the day. It makes you more alert and more productive at work. So the next time you tell yourself, I'm too busy to exercise, remind yourself I'm actually too busy not to exercise. Trust me, I understand that many of us have a hard time finding just 30 minutes to make such an important thing happen in our schedules. But I'm not a morning person, so I know I needed to recruit some other friends who are to wake me up, make sure that I'm out there at 5:30 ready to go with my exercise shoes on. Be creative. Walk while your kids are at practice. Get a standing desk at work. Prepare for your next board meeting while walking on the treadmill. Where there's a will, there's a way, and the rewards will certainly follow. The T in reset stands for take an assessment of your risk. There are certain numbers that we all need to know. As Dr. Cagle said, I have a certain passion for hypertension. Hypertension, you may have heard, is the silent killer because often we don't feel it just because our blood pressure is high. Yet it is the leading contributor to cardiovascular disease, and cardiovascular disease is still the #1 killer for all women and all men in our country. Nearly half of the adult population has hypertension, and less than half of them have their blood pressures under control. Almost everyone's blood pressure should be less than 130/80. So check your blood pressure. Make sure you know what it is, and if it's elevated, get it controlled. Know whether or not you have diabetes. This can be assessed by a simple blood test, checking your fasting blood sugar or your hemoglobin A1C, which tells us how high your blood sugars have been over the preceding 3 months. Having diabetes raises your risk for all kinds of cardiovascular disease, amongst other issues. Know your weight and your BMI. As each of these go up, your cardiovascular risk increases as well. Do you smoke? If you do, did you know that your risk of cardiovascular disease went up by 3 times? Get the help that you need to quit. Also know what your cholesterol is. Many people are hesitant about taking cholesterol medications, but one tool that we have at Cone Health is the coronary calcium score. So if you're hesitant about taking medications or your numbers are borderline and you have a strong family history, think about getting a coronary calcium score. This is a simple test that allows us to take a look into your heart and see if you're already showing signs of plaque that could warrant more stringent protection. Okay, so now we know how to take care of ourselves by doing a heart reset. So we've all started reducing our alcohol intake. We're incorporating meatless Mondays into our plant-based diets. We're taking times for ourselves. We're exercising. And we've even taken an assessment of our own cardiovascular risk. So how can we help lead our families to have healthier hearts? Well, fortunately, it starts with a lot of the things that we've already discussed. As we look at the children in our lives, did you know that obesity is becoming an ever-present problem, not only for adults, but also for kids? Nearly 20% of children can be categorized as obese. Some of the most popular activities for kids are sedentary, right? Tweeting, well, I guess we don't tweet anymore, we thread or whatever we do. But Snapchatting, doing stories on Instagram, watching shorts on YouTube, these are all sedentary activities. They do not contribute to the over 60 minutes of moderate to vigorous exercise that's recommended by the American Academy of Pediatrics. They also recommend that screen time be limited to no more than 1 to 2 hours per day. Yet our children are getting 6 to 9 hours of screen time each day. They recommended not having screens in the bedroom for children, and unfortunately some of us have already set precedents with that as well. So work with the children that you know and love to help them transition away from the sedentary activities and screen time into more vigorous activities like walking the golf course. All right. Another thing that we can do to improve our family's health is think about mealtime. Many of us play a large role in developing and determining our family's meals. Now, anyone who knows me knows that I am not the cook in my family, but I do help plan the menus. Now, fortunately, I have a husband who cooks with the soul of a grandma, and my eldest child should be auditioning for Top Shelf. But I get to order the ingredients, and then they make the magic happen. There's two things that I've learned. One is that if I don't know what we're going to have for dinner, by the time I leave for work in the morning, I'm going to make a bad decision at 7:30 when I'm on my way home and hungry. Meal planning and meal prep are key. The second thing that I've learned is that the power to control the options for food in my house often lies with me. If there is candy and cookies and soda in the house, it is probably because I brought them there. Now, that doesn't work as your kids get older. And of course, I have a husband who's completely able and capable of bringing those things home. But if I have to be honest with myself, most often it's me who wants to buy those kids the snacks that I know they love, but that don't love them. I've learned that as I make healthier decisions for our family and help control what's available, they've gotten more and more accustomed to making healthy choices themselves. The last thing to reflect on as far as caring for the hearts of our families is thinking about our aging parents. Make sure that we take time to connect with them. Encourage them to stay active too. Go for walks with them if you're fortunate enough to have them in your lives and nearby. That allows you an opportunity to assess their balance and the safety of the home. Check in and make sure they know what their medications are, if they're on any. Make sure that they know how to take them, what they're for, when they should take them, when they shouldn't take them, and help set them up for success. Help them get pill bottles and set alarms on their phones and things like that to help them to maintain their independence as long as possible. Check in on what meals they're eating. Make sure they're not just getting frozen dinners because they don't have a whole family to cook for anymore. So we've thought about caring for and leading the hearts of our own selves. We've thought about caring for our family's hearts. But we would be remiss not to think about how to help lead and care for the hearts of our communities. We are all members of a very fortunate sisterhood of women who's attained a certain level of success and influence. But with that success comes responsibility. It's not enough to say, my heart's good, my family's hearts are good. We have to think about the hearts in our communities. I urge you to advocate for heart-healthy lunch options in your workplace and to make sure that they're affordable for every pay scale in your building. Inspire and encourage your staff to go for heart-healthy challenges. Think about ways to make it easy for them to get exercise at work. Contribute to local food banks and community gardens, and when you do so, make sure that the contributions you make are healthy options. Advocate for and contribute to green spaces, and make sure that people have safe places to walk and exercise in their communities. Think about whether the legislations that you support and the politicians you elect are making it easier or harder for people in all communities to live heart-healthy lives and to get the health care that they so desperately need when they're ill. Remember, we are the heartbeat. We are the steady drum that leads with our hearts wherever we go. We must care for our own hearts so that we can care for those in our families and those in our communities. It's interesting because last night I got the last-minute jitters, and I was wondering, am I even on the right track with what I'm trying to say tomorrow? Is this what is expected of me? And so I started Googling at 11:30. And I came across Dr. Cagle's talk from last year. And it was so interesting because I learned that we have more in common than I thought. So she talked about her grandmother, who was born in 1908. and who lived in eastern Kentucky. And I thought, my grandmother was born in 1913, and she lived in eastern Kentucky in a coal mining town where the company store took all your money and kept you forever indebted to the city. And my grandmother, not unlike your grandmother, was an educator. So she went to school until 8th grade, and because of the times and her situation, that was all she got. But she became the Head Start teacher for the town, which meant that pretty much every little kid in the community had to pass through her door before they could start kindergarten. And not unlike your grandmother, it is impossible for anyone with the last name Calloway, it's my maiden name, to go to Benham, Kentucky and not hear a story about Miss Annabelle and what she meant to them and how she changed their lives and how she didn't have, as they say, two nickels to rub together, but she would give you the shirt off her back, literally. She would cook a meal for you, she would make a quilt when your kid was born, and she would make sure that you were getting your schooling and that you were making something of yourself. And what this made me think about was that despite our outward appearances, we have so much more in common than we ever would know unless you take the time to get to know people. It also reminded me that we may all have fancy degrees, but they're not really needed to be leaders, and certainly not to lead with heart. It reminds me of a quote by Maya Angelou, which I love, where she stated that people will forget what you say, and they will forget often what you did, but they will never forget how you made them feel. So I encourage you to remember to lead with your heart. Show that you care in all that you do. And with any luck, one day, when you're gone, your grandchildren, or those who you inspired, will be here to tell your story. Thank you.
Wow. That was so inspiring, Dr. Randolph. Thank you so very much. I learned a lot. I'm going to remember reset. I'm going to remember meal planning. I'm going to remember all this great things to really inspire our families, our communities, and our organizations. So, wow, that was really inspiring. Now what we're going to do is, for those on Zoom, we're going to take a little break, and if you all want to close out your Zoom and come back in exactly an hour, well, a little less than an hour. If you can come back at 12:30 Eastern, we'll restart the programming on Zoom. And for those in the room, what we're going to do is we are going to enjoy a heart-healthy lunch that's been prepared for us. I can't wait to see what all it is. It looks great over there, but heart-healthy. And remember to have your connections during lunch. Make sure you meet somebody that you haven't met before. And we'll come back together at 12:30. Thanks. It's meant to wake us up after lunch on my loudspeaker. But wanted to just welcome everybody back. Hope you've all enjoyed your heart-healthy lunch. That was amazing. I know some of these recipes I'm going to try at home. I thought that was really delicious. But welcome back to those of you on Zoom who have joined us back. We're super excited about this next part of our meeting. Today, what we're going to do is we're going to really wrap up the day. And what I'd like to do is welcome Lisa Cecchio, who is our Executive Vice President and Chief Marketing Officer for Wyndham Hotels and Resorts. She is going to moderate our panel, and Lisa is amazing at moderating panels. So I'm looking forward to this. And we have an esteemed panel of doctors and associates from Cone Health who will discuss how to achieve and sustain a healthy heart. So we're going to get further information. Dr. Randolph already did a great job of teaching us about reset, and we've got some great ideas we talked about during lunch. And now the panel is going to come up and dive in deeper and really give us some strategies about how women leaders can influence heart health in our community and in our homes. So with that, Lisa.
Extra mic for Q&A because I'm counting on you all. Hello, everyone. We'll try again. Hello. You really do all look fabulous in red. You know, we tend to wear a lot of blue at Wyndham, if you haven't noticed out here. But I don't know, Jeff. We might need to add a little bit more red to our repertoire. It is a really distinct honor to be able to be up here with all of these just fantastic, well-accomplished, well-acclaimed, well-written doctors, physicians, and technicians. Not only because they are that, but because they are women. And these women, amen, Mary Jo. And what I have found in my time with these women is that not only are they doing it because they want to do it, they're doing it because they believe they should be champions for women's health. They should be intentional in the way that we're thinking about ourselves and taking care of ourselves. And we heard that already from Dr. Randolph this morning of how important it is for us to think about ourselves. So we're going to spend about an hour together now. You know, to echo Dr. Randolph, let's be focused on ourselves. This is the S, I believe, in Reset, is to take some time to really calm our minds, to learn, and to be time together. You know, I have to say before I started, when I sat down at my table, I hope all of you have noticed there's a little picture on all of your tables. I thought it was one of our new hotels. And Krishna, who is our head of design and construction, is here with us today, and I was going to applaud him for this brand new hotel, but it is not. It is the new Heart and Vascular Center for Cone Health. I mean, I knew that there were parallels between hospitalities and hospitals, but I believe it now. We really can see it for ourselves here. And if you have not seen Dr. Cagle in a hard hat, I highly recommend a very quick Google search of this groundbreak. I believe, Ruth, you were there as well. These are some fine-looking women in some fine-looking hard hats breaking ground on this new Heart and Health Center that'll be open in 2025. And just congratulations for all you do to our community. All right, so to get us started here, I'm going to turn it over to our esteemed panel to introduce themselves, because I do believe that women should all have a chance to introduce yourself. So Ruth, I'll let you get us started. Great, thank you. Oh, Ruth needs a mic. We need to hear every word these women have to say today.
I can talk loud.
Oh, there you go.
Hi. Thank you. Thank you. I'm so pleased to be here. My name is Ruth Fisher. I'm the Vice President of Heart and Vascular Services for Cone Health. I've been in Greensboro for about 4 years, and I'm pleased to lead this team of fabulous and accomplished women at Cone Health.
Hello, everyone. My name is Heather Pemberton. I'm one of the newer cardiologists to Greensboro. I work with Dr. Taub, and we help run the Women's Cardiovascular Clinic. And I also do imaging, which Gaia is the head of. So I'm really excited to be with you all here today.
Hi, everyone. I am Kadi Taub. I am a cardiologist. Mostly interested in women's health. I will advocate for women's health every day of my life, as well as the founder of our cardio-obstetrics program. A little thing about me is I am passionate about what we call the social drivers of health. What I cannot do for you that impacts your health. So I just want to say thank you for having us here, and it's very humbling to be in front of all of you, and thank you.
I'm Gayatri Acharya, a cardiovascular imager, so I do all things pictures of your heart. Been in Greensboro also for about 4 years, and thanks so much for having us here today.
My name is Kristen Alstead. I'm a clinical pharmacist, and I get to work with these doctors on a daily basis. We work real closely in hypertension and heart failure and in cholesterol, trying to make sure people are on the right medications and helping them find the right ones when the standard ones don't work.
Welcome to you all. Now I will just share one quick personal note before we get started. This is a real personal moment for me. My father just retired after 50 years of being a cardiologist and internist. And he, since I myself am not a doctor, I told him I was going to be with 5 doctors and clinicians today who focus on heart health. He couldn't be prouder of all the work you continue to do in this profession. I applaud you all. And I share this story only because when I asked these very strong, accomplished women how I should refer to them today, because I was taught after 50 years, you refer to doctors as doctors. You've earned it. You deserve it. And these women said their preference is to be called by their first name. So I am doing it begrudgingly, but it was at their request. So I will refer to them as their first names, though. Congratulations on all you've accomplished. So Ruth, I'll start with you. So usually at these events, we typically talk about the importance of leadership, how we as women, what more we can do for our companies. But today we're focusing on heart health. Why is that important for women?
Sure. We just heard earlier today that heart disease is the #1 killer of women nationally and around the world. So it's incredibly important that we understand, both for our families and ourselves and our communities and the people that we lead, what the risk is, and more importantly, how to prevent heart disease. We all know that to fulfill our promise as leaders, we have to come to work with a healthy spirit, a healthy mind, a healthy body, and you can't do that if you're suffering from heart disease. So I applaud you all for being here to learn and to take action, even small little pieces, something that you learned today. I encourage you to take one thing and make one change in your life towards being a healthier person and heart health.
Thank you, Ruth. Now, Heather, I read an article you published last year that talked about how medicine is medicine. We all need medicine, but prevention is really one of the best medicine that's out there, and that can mean everything when combating heart disease in women. What can a woman do from any age to stave off health disease? Because I think sometimes as women, or just people, we think, when I get older, I'll start to worry about it. When I get sick, I'll start to think about it, or wait for someone else to get sick to start thinking about it. This is something we should be doing at any age.
I completely agree with you. Actually, thank you, Dr. Randolph. You set this up perfectly and kind of broke the hard news about the alcohol and the exercise. So I really, really appreciate you setting the stage. She is a bad guy in this relationship. No. So I will say really screening or prevention is appropriate at any age. So it doesn't matter if you're 15 or you're 105. It's never too late or too early for prevention. And as you said, prevention is the best medicine. I mean,
you said that.
As I said, prevention is the best medicine. I'm quoting myself. But that really goes to what Dr. Randolph had said about the reset. And really what we focus on, especially in our younger years, is those healthy lifestyle choices. As you can imagine, if you're in your teens or 20s, you haven't acquired a lot of those chronic conditions like high blood pressure or diabetes or artery disease, whichever arteries you want to talk about. And so if you capture people young and early, you can often help prevent those conditions from ever happening, or you can delay their onset or delay how significant they are when they do occur. So this is really talking about healthy diet. And as Tiffany had mentioned, this starts at the table with your kids. It's the Mediterranean style or the plant-based diets. It's getting out and exercising. I know that's really tough, but it doesn't have to be you hit 30 minutes every single day. It could be, I have 5 minutes. I can do 5 minutes now. I got a break in the middle of the day. I can do 10 minutes. It doesn't all have to happen at the same time. And just remember, even if you can't get the 30 minutes a day or 20, I think it breaks down to 21 minutes a day if you're trying to do 150 minutes a week. Even if you can't get that, remember every minute counts and don't discount that. So moving a little is better than moving not at all. I say that as someone who sometimes does not move at all. And then it's screening for alcohol use. For women, we try to keep drinks less than 1 a day. I'm sorry. And it does matter the size of the drink. Okay. And then you start screening for other things. Tobacco use for those, especially young. If you can get them to stop, then their risk significantly decreases. And think about how much you can prevent if you stop someone who's maybe smoked for 2 years compared to someone who stopped 50. And any time, even if you've smoked for 50 years, if you stop today, that significantly reduces your risk. But if you can catch them early, it's a really important thing to do. And then in your teens and 20s is when we start looking at your blood pressure. Am I running high? Am I someone who I can do something with my diet or my exercise or my stress relief that I can get my blood pressure down? This is when we're checking your cholesterol. Am I one of those few who has really high cholesterol at a young age? Am I someone who may benefit from not only lifestyle choices, but do I need to be started on medication early to prevent early onset heart disease? And then, it's a lot of, discussion about what does my path for prevention look based on the risk factors, both from my family standpoint and then where I'm sitting now. As Dr. Randolph had said, obesity is becoming much more common as we're younger. And so the path for prevention may be a little bit different than for a 21-year-old who has a BMI of 45 and is pre-diabetic than your collegiate athlete. But that's the beauty of prevention. Prevention is universal, but it's individualized to you as the person. And going forward, your journey for prevention may be a little bit different than somebody else's, but that's the beauty in medicine. You can individualize it to the person who's sitting in front of you.
So prevention doesn't have to be an all or nothing. It can be, so talk us a little bit through that, because I'm sure all of us have some bad habits that we probably are sitting here making a list of them in our head right now. So we've already written down all the ones that Dr. Randolph told us we can't do anymore. So what's something simple? I think, this is an educated room of very successful professionals. We know what to do.
Yeah.
How do we do it?
Yeah, I think that's a great point. And you know what? I always say this because you cannot be perfect. Let's call a space babe. We cannot be perfect. So I say, if you're good about 80% of the time and you're bad about 20% of the time, that's pretty dang good. And when you cheat, make sure it's totally worth it. Just make sure it's totally worth it, right? And I think, I think it's easy to start with one. Pick something in your life. Let's say I'm going to focus on exercise. And let's say it starts with 5 minutes a day. Today, I'm going to get up and I'm going to walk my dog at 6 in the morning because it gets way too hot otherwise. But I'm going to focus on this thing. And then once you get that and it becomes a part of your routine, then you tackle something else. And it's okay to fall off the prevention train. You can always get back on. It's just pick yourself up, refocus, and you can do it again. There's going to be days that are worse than others. There's going to be times that you just can't do it, and that's okay. At the end of the day, just try to get back on that prevention train.
Maybe this is a question and we'll move on from this prevention idea, but I think we're going to keep coming back to it. Is it diet or exercise for heart health? Is one more important than the other?
Ooh, the $1 million question. Do you guys want to weigh in on this too?
I think the patients I see who are in their 90s, the one thing they always tell me is, I exercise. Mm-hmm. Whether they're the kind of little bit of brandy and a cigar every once in a while, but they always say they exercise. So I guess I think it's a tie, but I think maybe exercise edges it out just a little bit.
And I would agree with Dr. Acharya. Because if you think about countries where people are not having access to cars, right? Most of the time, they're really in good shape because they're walking places. And I'll tell my patients, I say, well, when you go to the mall, where do you park? I'm like, just at the door. And you're so angry that somebody took that parking space. Or you go into park further down. Or when you go to work, where do you park? So little things like, okay, I'm going to work, park the farthest behind. Okay, Mary, park at your parking space that's 3 doors from where you enter. That's okay. So little habits like that, incorporating the exercise, and don't forget about the diet. I'm not sure about the full plant-based diet, Dr. Randolph, but a sneaking fish and everything there. But what I'm saying is we may not all be able to do the full plant-based diet. I'm from a West African family where when you open a pot of soup, it's like they have pork and meat and fish, and it was like, we're cooking good, So we have to scale back, and as we do that, scale back with the diet and scale up with the little things that we do in our day-to-day activities that are going to, do you really need to take the elevator, the 1 stairs, you know what I mean? As long as you're able, you can just walk up those stairs. At the first time, you will probably be, but it works. It really does. Mm-hmm.
So would walking a golf course at a professional golf event does that count as walking? Oh yeah, I think so. We have something that might be helpful for all of you in the next few days if you're looking to change your habits. So, Cardi, let's stay with you. I was amazed to hear you talk earlier about
Obstetrics, cardio-obstetrics.
Which I had never heard about before. But I am also amazed at the mortality rate of women during pregnancy in the United States. I mean, we read about mortality rates around the world, but in such a developed country, our own country, to think about how high those rates still are, and particularly for women of color.
Yeah.
What drove you to this particular, to be this champion of this type of discipline, and what more as a community or as even in our own lives, because this is something you were saying is not just when you are pregnant, it's before you're thinking about pregnancy and well after, which is also something that women have to really start to think about.
So it's actually personal, but I'll answer the question before I tell you why it's personal, and you'll understand. Cardio-obstetrics, so the reproductive years are pretty much the forgotten years for women. Pretty much, you have your baby, you raise the baby. When they're 18, you're, oh, my life is about to begin. But that is actually one of the most sensitive time. We try to go pre-reproduction, like look at why, before you get pregnant, we try to look at the women in their whole life cycle. Because everything you do, that's what we call the sex-specific risk factors. Guys, you can listen in, because you might have females in your family that may be affected to this, so please pay attention. You, as a female who is planning to get pregnant, and now that we're kind of going back into our careers, we're getting late on pregnancy, heart disease starts early, hypertension, Dr. Randolph talked about, obesity, diabetes, all those things really affect you. So before you get pregnant, let's start there. Before you get pregnant, you really want to be talking to your primary care doctor, the OBGYN, or people that educate them. Because we need to understand, first of all, the medications you're on, is it going to help? And that aside makes your risk high for the high blood pressure you're going to get in pregnancy, or complications like preeclampsia that are going to eventually increase the risk for heart disease. So traditionally, we look at postmenopausal women and thinking that is the risk factors. When you're postmenopausal, you're going to have heart disease, and people look at you like, did you get screened yet? No. Let's take a step back and look at younger women, and that is the reason why we're looking at the number at 1 in 3, right? So when we were talking, there were 3 of us. There was Lisa, and there's someone else, and we talked about the 1 in 3, and I think I made them uncomfortable. I did, because she said 1 in 3, right? And I said, yes, more likely me. And because I'm a minority woman, and we know the statistics that minority women have higher chances of developing heart disease. There's a lot of different factors that play into that over the years, with the social determinants of health and the access to care and all of that factor. But going back to what you were asking, is we want to take care of women now during our reproductive years to make sure that the complications that are associated with heart disease does not develop. So if you had your baby at the age of 32 and you had preeclampsia, you had gestational diabetes, please don't wait for 65. Talk to your sisters, your friends, and your daughters. Do not wait for 65. You really have to go and get screened early. Look at that 10 to 15-year mark, that calcium score that Dr. Randolph alluded to. You want to get that screening done. In addition to that, why is that happening? We ask ourselves, we're in the best times of our lives. You're having a baby, and why are women dying during their reproductive years associated with pregnancy-related complication? Some of the whys I can give you. Some of the whys are, we just have to be our own advocate. It is not okay if you tell a doctor that something is wrong with you and they said, go and come back, and you're walking to the elevator that you shouldn't be walking on, by the way, going down the stairs, but you're walking and thinking to yourself, that didn't sound right. You need to either get your doctor, meaning the doctor that's going to advocate for you. And you can do it one of 2 ways. You can make another appointment and have a very appropriate conversation with that doctor. Because sometimes we're going through all the things. You can say, stop, wait a minute, this is going on. Is there a way we can do 1 or 2 things? Can we do something about this? Because that is the first reason why complications is going to happen, because then you wait, or the person waits. The second thing is, during the postpartum times, we have this issue. So nobody can tell me that right now, when you look at maternal mortality, that the United States is better than Haiti. If you can tell me that, raise your hand. Nobody can tell me that it's better than Nigeria, the Gambia, or anywhere else that we call the third world country. Because you know why? Our women are dying. And there's nothing that has been done over the past years that has changed the situation. We're doing the same thing, and the numbers keep telling us. CDC's put it up, oh my God, maternal mortality. We need to change the way we think. We need to change the way we take care of our reproductive years. So it starts by us. We need to say no. And you know what you ask Ness? Tell me why. Because if that person taking care of you cannot give you your why, they're not your doctor. And you tell your family members that you need the why. And then the next step to the postpartum, Dr. Pimpleton and I deal with it all the time. Not deal with, but we have that situation all the time where it saddens us, where we have a postpartum patient, a lady that's supposed to come back. What happened? She has no insurance. She's afraid because you know what? 12 weeks after, it's got cut. Medicaid's gone. You know? So we need to do better by our women, because if we extend that to 12 months, most of the complications that happens that didn't happen before, that didn't happen during the pregnancy, it happens within that 12 months. So if she is worried about taking care of her baby, if she's worried about taking her kids to school, the last thing she needs is going to the doctor without health insurance and getting that bill. She's gonna find another way. And by that time, she's in heart failure, pericardial cardiomyopathy that leads to heart failure. She probably has had a stroke. And the reason why it's personal for me is the advocacy. And let me tell you, when it comes to the minority women, it doesn't matter what your checkbook says. It does not. Because I have a personal story for that. My cousin, who was an endocrinologist, that's her doctor, right? So she lived the right life and did everything, had a complication at birth. But she was the statistics that made it true that we don't need to do. She was that 1 in 3, but because she's not advocating for herself as a doctor, she died. So that's why it's personal. I don't want to go that way. I don't want my daughters to go that way. You don't want your friends to go that way. Think about it, right? Everybody here has a friend that's a female. You know, if you don't have one, make one. There's one next to you. There's so many of them, so, you know. So everybody in here is influenced. We have mothers, we have sisters, we have daughters, we have friends, we have neighbors. You don't want it to be any one of them. And not postpartum when that's the time that everybody needs to be happy.
Well said. Well said. How about a round of applause for that answer? I wish you were my doctor when I had my babies. They're done now. But I'm going to make sure all the women I know come to you. So, Gaia 3, you also are such a prolific author, telling us all ways to avoid the risks of heart disease, preventative tips. Again, you sing the praises of prevention is the best medicine. We hear all the time about screenings for our health, and as women, particularly mammograms, pap smears, colonoscopies. But what is it for our hearts?
So this is a kind of a great thing to think about, and hearing you phrase the question reminded me that a lot of the other societies have done a really good job outlining what is the preventive step you take to prevent the cancers, the progression of disease. I don't know that we've done as well of a job in cardiovascular societies to advertise this, so here I am to tell you all about it. And Cone Health, I have to brag on our imaging department for a moment. It is state of the art. We offer everything you could possibly want to image your heart, but the one thing I think that is so key, we offer a coronary calcium CT scan, which Dr. Randolph mentioned and several of the other panelists as well. So what this is it's a CT scan. So you'll go You'll go to your hospital's radiology department. If you're not local to Greensboro, please come see us at Moses Cone Hospital if you don't, if you do live in Greensboro. But you'll go and you'll have essentially lay in the CT scanner. They'll prep you for a moment. There's no IV required. They'll literally whip you through the scanner, seconds really, and it's done. And that's it. It'll spit out some pictures on the other side that a radiologist or cardiologist will take a look at. There's a formula that's been developed to calculate the calcium, and from there you're placed on a spectrum of low, medium, or high risk calcium scores. And from there we can risk stratify you. So for no contrast, for sort of a relatively affordable fee, it's not covered by insurance, so if there's anybody in the room who can help me with that, I think this is a really important preventive step. But I think it's fairly accessible and very easy to complete. Once you get your coronary calcium score, you either have it or you don't. That's kind of my first deciding factor. So a lot of people in this room may go for a calcium scan and find that you have no calcium in your arteries. That's awesome. It doesn't mean you don't have coronary disease, but it's a way to tell us maybe your coronary disease is slightly lower risk. Let me place a caveat on this though for a moment. A coronary calcium scan is a study for a patient who is not having symptoms. I really feel very strongly about that. The guidelines have suggested that maybe we can send patients who have some kind of odd chest pain symptoms, but I really, in my practice, reserve it for people who are, I feel great, but my cholesterol's not doing so well. How do I find out where on the risk spectrum do I fall? If you have no symptoms, cardiovascular symptoms, meaning when you walk, you don't get chest pressure, when you walk, you're not short of breath, and then you have a 0 calcium score, I feel confident telling you, I think your risk is low. You keep doing all the right stuff, but I don't think we're headed in a super high risk kind of direction at the moment. So kind of speaking to getting things done at a younger age, that's one thing we can do to really understand, especially if you have a family history of heart disease. This is a test I think that will empower you to know, where am I on that family kind of history spectrum as well. Beyond that, if your calcium score came up positive, meaning that it's anything above 0, then we lay out the risk stratification categories. Up to about a score of 100, that's still in the lower risk category. About 100 to 400 is this intermediate risk. We add together your cholesterol and other factors and decide maybe what to do next. Once the calcium score goes above about 400, you're technically in this higher risk category. And in my practice and kind of based on the guidelines, anywhere kind of upwards of 800 or 1,000, it's time to start testing the heart and seeing, okay, there's a lot of blockages. How do we test it to see if they're significant? And that's when your doctor may recommend a coronary CAT scan, where they do inject contrast dye to look, or may recommend a stress test. Sometimes even a heart catheterization, but often we can accomplish it with imaging before we get to that point.
So you're saying we feel healthy is when we should come in and have this scan.
The coronary calcium scan, exactly.
Does that have to come from our, do you need from our primary care physician? Can we just come?
Absolutely. I think at Cone, if I recall, you have to have a referral from your primary care physician. At other health systems, there is a sort of optional private kind of, you just pay the fee and you go and you have it done. It's good to have a chain of command for this, so that's why I recommend one of your physicians order it for you, so either a primary care physician or your cardiologist, so that there's somebody responsible for the results on the other side and will help you interpret that.
But we should think about that type of scan the same way we think about our annual PAPs and our mammograms and everything. We should be thinking about getting a baseline for our heart.
I really think so. And this test is the scoring system that we use then is placed against this large database of patients. And it's validated for patients, anybody about 45 or older. So when I turn 45, I think the first thing I'm going to do is go get a coronary calcium scan. It's certainly useful before that age, but if we want to kind of be compared to our peers, people who are age and sex matched and really race matched. Now, of course, I'm South Asian, and South Asians weren't included in that original subset of patients, but Black, Hispanic, white, and even Asian, Chinese Asian, those are categories that have been studied, and so you can be compared to your peers and really understand where in a risk do you fall based on your age, your sex, and what your ethnicity is.
Thank you. So, Kristen, I'll turn it over to you now, our resident pharmacist on the panel. You know, we are bombarded every day by commercials on medication, social media, pop culture, celebrities, and all. I feel like it's all the rage now of them all wanting to tell everyone what medication they are on.
Right. There is
that
a lot of advertising out there.
Yeah.
And it's real challenging because as a pharmacist, I don't know what some of those drugs are for. You know, they advertise and there's all these flashy pictures about how beautiful life is going to be and you just need our drug. And then they list off some very rare form of colon cancer that might hit 1 in 100 colon cancer patients. And you have to wonder, why are we suggesting to the public that it's a good idea that you tell your doctor which drugs you should take? That's just, you know, we really need the doctors to be more on the side of, based on your condition, where do we stand with which medications are going to work for you?
So what is the best source of figuring out what medications to take?
So really your best source is your doctor and your pharmacist. They work in teams. Now, not all practices are lucky enough to have both of them on staff, but you get your prescriptions from your local pharmacy for the most part. Don't be afraid to talk to that pharmacist. They have a degree. They spent 6 to 8 years in college learning about these medications, not so they can count to 30 and put a label on a bottle. Their job really is to know when these medications interact with each other. Their job is to flag that and to warn you. But in many businesses, they're very short-staffed and they kind of push that aside. But you still need to go up and say to them, please explain this to me. Your doctor should also know what they're giving you. They know the side effects and whatnot. Now, we're lucky we have a practice where we can work together, and when patients have side effects from drugs, we're able to talk to each other in the office and try to figure out which medication will be best based on what's going on with your symptoms.
So not Kim Kardashian on Instagram?
So please don't listen to Kim Kardashian. Dr. Google does not know all the answers. If you look things up on the internet, please take it with a grain of salt. You can find an answer, your answer to anything you want, because when you start Googling, you already have an idea of what you want it to say. You want it to say, this drug is not good, I shouldn't take it, my doctor's wrong. And you will find somebody on the internet who agrees with you. And you really need to not trust the internet for these sources. If you do use the internet, use a reliable source. WebMD, GoodRx actually has a lot of good information on it. Make sure it's a reliable source and it's not some web page that's full of people stating their own opinions and then backing each other up with those.
Well said. I think that's a round of applause answer, too.
Thank you.
No more Dr. Google. So I'll open this next question up to all of you. You know, I applaud you for, like I said when we opened this discussion, around your intention specifically around women's health, because women's health is different than men's health. I've been interesting to research that women's heart health is diagnosed so much later than men's statistically. Why? Why is that?
First, I'm sorry, guys.
Are the factors
I just
the
can't
same or
help
are they
myself.
different?
It's like, you know, is that like that song? I'm so excited.
Karaoke is later.
But here are a few things. So I'll just share with you. There's a Time magazine in a Reader's Digest magazine that I have that I always use when I talk on women's health, you know, generally. Reader's Digest said many years ago, what to do to stop your husband's heart attack. Okay, all right. A lot of women read that. And Time said in 2001, heart disease is the #1 killer of women. I'm talking about probably 20 or 25 years in between. So what happened along those times hasn't changed much. It's the fact that most of the data we had years ago was based on data that was obtained by males. That one day, I probably got in trouble for this, as a fellow, there's a person that came in, and a fellow is just learning to be a subspecialist, so I was still learning, and a female came in and she was having just mild symptoms, and she was probably 40 or 45, and you know, I told the ER doctor, I said, oh, we better get an EKG, or, you know, he looks at me like, huh, she's not having anything. Look at her. She's just like doing that. And I said, her heart didn't read a textbook. And the reason why I said that is because we have now known that the data is based on what they've done for men. You know, we are not small men. We're not. We are the people that were placed next to males to work together. So the data, so two reasons, there's two flaws with that. It's not the male's fault that we don't have the data. We take full responsibilities of that too, because there has been historically, and we wrote an article about that last year, that women have a lot of decision makers in their life. Women will not take the first step to take a challenge. And we overthink things that to really sign a consent that is going to be experimental, it's one of those things that we're like, oh, I gotta call my cousin who knows about this. And then you call your cousin, he's like, no, don't do it, don't do it. So that's one of the reasons. So we have less data, we have less information that really has changed. And then over the trending times, that's getting better. Advocacy needs to improve, and then we have to change the way we think. Now that we're incorporating what we call sex-specific risk factors, sex-enhancing risk factors. So sex-specific risk factors are those things that I talked to you about. We're the only person that can get it because we get pregnant. So even though that's pregnancy related, there are also things like PCOS that can cause you. So not having a baby, so someone who doesn't have a baby like Dr. Top, whatever, I don't know, I don't need to talk about it, but not having a baby, trying infertility also increases your risk on a small scale. That will have to be coupled with the fact that you probably have a family history, as well as those sex-enhancing risk factors, so women who also have lupus, those inflammatory sclerosis, increases that risk. Women who've had breast cancer, especially on the left side, that has been treated with radiation, that increases the risk of heart disease. So now the symptoms really, anything is fair game, really. But the one thing that we really say is, of course, there's going to be the traditional heart. Some women feel that. Some women can be fatigued. And yes, that lady actually was having a heart attack. So that's why I didn't get in trouble for talking to an attending the way I did. But I just needed us to do something for that woman. So the symptoms will be different. So we're not thinking along those lines. And then there's that implicit bias of she is 40. She is not a candidate of a heart attack. So please tell me who that candidate looks like. For me, it's everybody who has the symptoms, risk factors. So to sum it all out, it's just we have to advocate. We have to understand the warning signs that things that doesn't belong to our body. And we just have to be able to recognize and help if we're approached about a research study that's going to benefit women. Let's do it with education and understanding what are the things that are going to happen to you, if and when. And then get that consent and do that. So I'll let my colleagues add.
Oh, that's fine. Oh, okay, there we go. I think Dr. Taub put it beautifully. With women, we have certain risk factors that are often under-recognized. So, for example, as Dr. Taub had said, if you had preeclampsia, gestational diabetes, if you have an autoimmune condition, which is 9 times more likely to affect women, if you had premature menopause, you have risk factors that are often under-recognized. We're underrepresented in clinical trials. So a lot of the times we didn't know that your symptom was in fact a symptom of a heart attack. And we're learning that, women are much more likely to present atypically with heart disease. So you hear classically, oh, I'm having chest pain when I walk, but a lot of women don't have that. It's, man, I'm just feeling wiped out, or I'm really short of breath, or you know what, anytime I move, I just get this funny sensation in my jaw. It's weird, or I have less get up and go. I'm dizzy. And a lot of times that's overlooked. It's, oh, you're anxious, or, oh, you worked 12 hours yesterday and you're dehydrated. But I think, to Dr. Taub's point, is being your own advocate, when something's not feeling right. And then like I do, I'm like, oh, it'll go away. This is going to end. But if it's not, make sure to seek. The thing is with heart muscle, time lost is muscle loss. So if something is happening and it's not going away, don't sit at home and wait on it. Seek treatment and make sure you get seen early, because if there is something wrong, if you get the intervention sooner, we're able to save more muscle and improve outcomes.
Women are often referred less for procedures, or at least in a delayed fashion, and there's actually data to back that up, as you suggested. But now, with the growth of imaging in cardiology, we don't have to send everybody to the cath lab. So one, you don't have to be afraid to go for a procedure that maybe you need, maybe you don't. There are ways to kind of get a better sense of how risky is this chest pain that you're having, or perhaps does it represent something else? Is it stiffening of the heart muscle? Is it pulmonary hypertension, which is high blood pressure in the lungs? It could be, there's so many different things, especially with the conditions that both of you mentioned, that it could be something else. And there's a bevy of non-invasive tests we can use that are very low risk that can get us a diagnosis. And I agree. I think if you think something's wrong, advocate to get those tests done.
So Ruth, I'll turn it back to you, if you don't mind. I've been reading about the Healthy Weight and Wellness Center, the Heart Sisters program that you have. It's clear for anyone in the community, if you're not aware of these programs, so many programs geared toward women that just help you maybe to take that first step. I'm tired, maybe I'm not sure, maybe I should come and see someone. What is on the roadmap for Cone Health? You have already so many programs that are focused on it. We talked a little bit about the hospital that I hope you're going to share a little bit more on, but what's on the roadmap and why?
Sure.
Why is it so important to Cone Health?
Sure. I'm really proud to tell you all about our investment in heart and vascular services at Cone Health. And I'd like to thank Dr. Cagle and May Douglas, who are chairman of the board, who have invested over almost $200 million in capital in the communities that we serve. And that's an incredible statement of support for these professional women, for our community, and for our families. And so what we're doing is we're building a great heart center. We just broke ground a few months ago. It's going to be a state-of-the-art facility here in Greensboro that will support all of their work, and it will enable us to continue to recruit world-class talent to Greensboro, to Cone Health. You have to, I'm the only non-physician, non-clinical person on this panel. I'm humbled to be among you. But my job is to support them. My job is to build a program that supports their work, that supports the team that they lead, the technicians, everyone in the heart world, because it's really a team. We've talked about the teamwork that we have amongst us just on the panel, but that includes our technicians, our medical assistants, a bevy of hundreds of people. And by investing this money in capital for the building in Greensboro and for the expansion of our acute care services at Alamance and here at Moses Cone Hospital, we will be ready for the next 10, 20, 30 years of supporting all of this work for men and for women, right? Heart disease affects men and women. We're talking about women today, which is really important. But Cone Health is taking that a very important step to invest in heart vascular disease and supporting this team so that we can save people's lives, and most importantly, we can develop and advocate for the prevention work so that our community won't need to build bigger and bigger hospitals for the next 30 years. We can keep people at home, we can keep them well, and this team will be pivotal in that work for the next generation.
We applaud you. Congratulations on the new wing. Now, it is very exciting. So I have more questions, but I want to be mindful of the time. So I want to open it up to the audience, anyone on Zoom or anyone in the room that has a question for our panel. Don't be shy.
Thank you. Dr. Taub, I have a particular position that I play. I'm the congresswoman for this district, and one of the areas that I focus on is healthcare, and I've had a couple of bills to try to get at the issue of maternal mortality and the incredibly high rate the totally unacceptable rate that we have. So when you talked about women participating in drug trials more, it reminded me that last week, one of my legislative assistants brought something to me asking me to sponsor, which would be a bill to get more pregnant women and nursing women into drug trials. And since my background is as an attorney, of course I panicked. You know, what is this going to do? What kind of liability will we have? But when you talked about that, I wonder if you could talk about how do we get pregnant and nursing women into drug trials in a way that's safe and appropriate, because if we don't do that, and this really came up during the pandemic when there were so many women where doctors didn't know whether they should tell them to get vaccinated or other steps they should take. So there's clearly a need, but how do we do it in the safest possible way?
Thank you. Well, if I knew you were here, I would have not talked about Medicaid expansion.
This was perfect. I couldn't have asked for a better panel.
Thanks for that question. So that's one of the populations that we have to be very careful. Research is much needed, but one of the biggest things is to get a team of physicians involved. And when we're looking at these medications, we have to understand, because they go to phase 1 trial, phase 2 trial, what did phase 3 show us? Because that actually is the clinical part of those medications and things that we're doing. What did phase 3 show us? What's the data telling us? And then we can make choices from there. 2 things we have to be able to consider. Number 1 will be, what's the impact on the fetus? What that means is, giving this medication as a trial drug, what is it going to do to the baby that is being developed? And after that, what is that going to do to the mother? That's been a big topic now with CMS. They've had a couple of workshops that I've sat on and talking about how do we incorporate reproductive years, which is much needed. So the biggest thing I got out of those workshops was, number 1, we should not make decisions without physicians involved. That's the first thing that I got out of it. Number 2 is, even though physicians are involved, are we getting the right people to be there? Number 3 is the clinical data. And ethically, we have an ethical responsibility to the community of people that we want to recruit. How are we giving them that information? And number 3 is, once we get that data, how are we reporting it? Because we can do everything right and get the phase 3 information and get all the right people involved, but when we get that data, are we reporting that the right way that the impact has shown that we can be able to really give it to the masses? So, thank you. You're welcome.
I wanted to ask the panel, what are the thoughts about Medicaid expansion? Do you think that'll help some of the issues that have been going on? I guess Dr. Todd mentioned.
I'll take that. So as I said earlier, the social driver of health is one of my passions. So if you take those 2 things away from me, I would probably be a fashion designer. But Medicaid expansion is pivotal. It's very important for our at-risk, most vulnerable population, hardworking folks, but just can't make it, can't get their health care. And think about now going back to even the maternal group. Because we don't have Medicaid expansion, they get 12 weeks and that's it, okay? We've got people who've worked hard and have not been able to get medications. So if we're able to get Medicaid expanded, some of the prevention things we're talking about, like I said, pull me out of a job, I will just do design. But I want our community to be healthy, you know? Think about the kids that play together. They're all playing together, but they have different circumstances. And some of the times, you'll ask a kid, how's your mom? Oh, she's sick. But it could be something that could be prevented. So I think all of you in this room have an influence on how that can be changed. We have a voice, right? It's not just the voice that we use to say hello, but it's the voice that Dr. Randolph said, your mind is the most important thing that you can use. So sleep well. Use reset, sleep well, and use that voice so our lawmakers, Ms. Manning, can be able to really hear us. Use it not vindictively, but use it as a power and an empowerment too, so that we can be able to get those bills passed.
Yeah, thank you. I'd like to add to that. I'd like to thank Dr. Cagle for advocating for Medicaid expansion in North Carolina and others in this room. I'm from Detroit, and when we, yes, I'm from Detroit. We need to talk later. When we did Medicaid expansion in Michigan, and I worked in downtown Detroit, it changed the community just like that, because people who were coming to the emergency room for their primary care because they couldn't afford primary care, they couldn't afford to see the doctor, they were now able to get real care, prevention, primary care, build a relationship with the physician, build a relationship with the health systems. They didn't mistrust us anymore. We were partnering in their care. That was all because of Medicaid expansion. So I'm so proud of North Carolina and all those that fought for this, because it's going to change. It will change the lives of the people, of the community that we serve. So I'm really, really grateful for all of those who helped, and I think it's just going to be a game changer for all of us who are in the healthcare world.
Thank you for the question. Do we have another in the back? Thank you.
Hi. Today has been very impactful for me, and I've related to a lot of what I've heard. I take care of a 9-year-old daughter. I'm constantly thinking about our health. I take care of my mother, who's 70-something and has a lot of health issues. And I have a cousin who passed away within a day of having her second child with one of her children who was only a year and a half. So I really understand everything and relate it to a lot. So I have a question. What is Cone doing with respect to the whole patient, the whole person? So I agree with Dr. Randolph when she said the heart's like the most important organ. I get it because of the things I do with my mom. But when you think about it, the heart has to communicate with the kidneys, right? And there's all these interrelations between different systems in the body. So what are you guys doing to ensure that your cardiologists have a seamless way to communicate with the other specialist, where you're really thinking about the whole patient? What's Cone doing, and what are you hearing in healthcare in general to kind of move that needle? I advocate for my mom a lot, so I force that conversation between all of her doctors, but it only happens because I force it. So I'm just curious what's being done at Cone and what are you hearing elsewhere?
So, you got it, Ruth? I can go ahead for it if you like. Okay, so, all right, while they're getting Ruth's mic on, there's something I wanted to share with. So part of our initiatives, and Dr. Cagle, thank you for this, is the healthy communities. It's one of the things that we have as part of our goals as an organization. And one of that is getting not only the physicians and subspecialties together to work in line and in alignment with our organization, but to also get the community involved. So we have had lots of conversation, and I'm in this unique role where I also work for our Center for Health Equity. So I'm able to really see these things live, not just hear it in our Cone Connect and see all the things, but what we're doing is collaborating, making the work that we do as cardiologists know what the right hand is doing with the left hand, meaning that we know what the pulmonary service line is doing for us to be able to connect for that one patient. The other thing that I'm proud of in being part of in that role is our Sagewell. At one of our facilities where Dr. Randolph is, it really gives a good feel, because at that facility where you're able to, there's a gym, there's different programs, exercise, and there's mindfulness things, and they even have places for kids to really play that people can keep that in touch. And then one of the things that we do, part of Healthy Communities, is really from the Center of Health Equity. We call that collaborative action towards community health. That came about from looking at East Greensboro and looking at the other side. And who would have thought where you live will tell you how long you will live, right? So up on the other stream, people live 10 years longer than the other side. So part of that is not only physicians working together, it's putting the community to work with Cone Health, because we want to build the trust, right? Because this is our community. We want to build the trust. We know the community is here with us. And there's Ms. Meg Douglas there with us at the Chavis Center too, because I'm part of that work with our cardiometabolic. So it is just a fascinating time. So we work together in alignment, but we're focusing as well with healthy communities with getting collaborations. I'm sorry, Ruth, I was waiting. That was too long.
No. Sorry. I just want to mention the fact that Cone Health, and I know this is a lot about Cone Health, but we have an amazing culture here, and I'm just privileged to be part of this group. Our physicians speak to each other on a regular basis. I've been at health systems where specialists don't like each other and they don't talk. And so guess what happens? The patient suffers. That is not the case at Cone Health. That's not a case among our heart and vascular service line, nor any of the service lines that I have had the pleasure to work with while I've been here for this last 4 years. So I think a lot of it starts with the culture. We are collaborative. We put the patient first. The patient is the center of what we do. We have an EMR that supports all of our work, so we communicate very seamlessly. We have physician leaders who are leading their health systems. So physicians are leading this group. So they know they've walked the walk, they talk the talk, and now they lead the entire health system. So there are lots of reasons that I think, lots of ways that we are trying to connect and thinking about the patient as the whole patient and not just one particular slice of a patient. And then finally, Dr. Cagle has really set a goal for us Cone Health is going from success to significance. So as Dr. Taub mentioned, we are not just thinking about being an ivory tower of whoever can pay for insurance will get the best insurance. We are really collaborating across all the communities that we serve to bring everybody up, rise the health of our entire community, just not a sliver. So it's really a good time for us, I think. And thank you for that question. That's a really great one.
Can I add to that?
Yep.
I don't know. Oh, okay. I think you're also kind of getting at this idea of team-based care. And I think as disease complexity rises, and I think it's a complicated patient. Your patient doesn't just have heart disease. They might have heart, kidney, lung. They might have had a stroke. And so this whole idea of a team-based approach to the patient is really growing. And I think we're taking big efforts to ensure that, as you said, that there is communication so that we are on the same page in terms of what are the next best steps for the patient. And so like my organ very much impacts the kidney. The kidney very much impacts blood pressure. It's holistic. And in order to ensure that your loved one is fully cared for, you have to have a team-based approach. Medicine is not practiced on an island. And I think this whole idea that like there needs to be communications between teams, between physicians, between us and pharmacy, it helps provide a much more holistic approach to the patient. And I think that's the way that medicine is going, and that's the way that Cone promotes us to go. So for example, I have a patient who has a laundry list of conditions, and every Friday I have a meeting about how, with a nephrologist, a neurologist, a pulmonologist, about what we are doing to help optimize her care, what procedure needs to take place, and they're all on board. And it's a very collaborative dialogue, but it's something that needs to happen in order for this patient to do well. So I think that's a great point. And this whole team-based approach is something that's really growing in the Cone Health system.
Thank you for that question. We have time for one more. If anyone in the audience has one more question. Oh, we got one more.
I have a really short one. I'd never heard of the coronary calcium test before. You said it might be like these other tests we get. Do you get it once? Do you get it annually? Do you get it every 5 years, 10 years? What's the...
That's a fantastic question. So practices vary a little bit on, physician to physician, but the guidelines would suggest get it once at least to get your do you have it or do you not. If you have no coronary calcifications, you could, you get that test again in about 5 years and the data may change, right? In 5 years, a person may develop coronary calcium. Once you've got coronary calcifications, there's really not a strong indication to repeat that test again. What might be more informative after that is an actual assessment of the plaque. And at Cone, we're actually, we're kind of, singing the praises of Cone today because that's where we are. But we are onboarding some new technology and AI at kind of light speed. And one of the things we're doing is with our coronary CT scans, the ones where they inject some contrast dye to look at the blockages, we're actually able to assess the plaque burden now, which is incredible because we think that it's not just the amount of blockage you have, it's what are the characteristics of that plaque. We've heard of sort of more worrisome plaques, different features that make it more likely to rupture and cause a heart attack. So get your initial calcium scan, and from there it may indicate, okay, I have none. Let's check this again in 5 years and kind of aggressively treat your cholesterol in the meantime. But if you do have calcium, what's the next test I can get to tell me more beyond just a plain old score? Why isn't it covered? I have no idea. So this is, if you think about it, this falls in the same realm as any preventive test. Really, I mean, it changes the care of my patients. And actually, interestingly, we do CT scans for multiple different health conditions, pre-procedural, things like that. And we're able to see coronary calcium on that too. And it has a change, people have taken a 180 turn from the original plan of their procedure after having just recognition of coronary calcium. So I don't know. And hopefully it's coming down the line. At Cone Health, it's $99. It's, and that's not an insignificant amount of money. The way I put everything in the context of food. So how many meals is that for me? How many dinners out? How many kind of recreational activities? But nevertheless, I think if $99 is within the realm of something that you find affordable, I think it's money well spent.
We have Health at Work here. Oh, I'm sorry, I'm back on. I believe we have somebody from, if you're interested in the calcium score and any kind of health issues, we have someone here. Where's Jill? Who is available to answer more of your questions and help you further your journey, your healthcare journey.
All right, so I'm gonna ask one question to wrap us up. I know that we can keep going with these just incredible women. We've talked a lot today. I think everyone who is leaving here today knows now we're taking care of our hearts. Hearts of ourselves, hearts of our homes, hearts of our community. What is the one piece of advice, Kristen, I'll start with you and we'll work our way down to Ruth, that we have to take as we leave today?
So from a pharmacy perspective, a lot of it comes down to if your doctor tells you you need a medication and you're feeling healthy, but you go in and your blood pressure's a little high and he says, you know what, we need to treat it. Go ahead and treat it, and don't take the medicine for 6 weeks and say, oh, my blood pressure's good, and stop. Taking a medication to prevent something 20 years down the road is not a negative. People look at their medicines and they say, oh, now I have high blood pressure. I'm up there with my dad, or I'm up there with my mom. And really, we're trying to prevent a lot of things that can come down the road. And high blood pressure is one that leads to a lot of health issues. So please, if your doctor gives you a medicine for high blood pressure, take it. Over the years, if your blood pressure comes down because you lose weight, you start exercising like we ask, you're eating a plant-based diet and all those things, sometimes your blood pressure may come down and we may be able to stop. But that's right now very few people. So please, if their doctor gives you something, we're giving it to you for a reason. We are trying to prevent you from becoming a regular at our office.
You only want to see us here.
Yeah. So I had a different one coming in today, but after Dr. Randolph's talk, I changed mine, my one piece of advice, and that's caring for your parents and your aging parents. And what's so interesting is, any of us who eat cultural foods, anything that's sort of ingrained in your history, we have to help our parents adapt that for current healthy eating standards. And it is like pulling teeth. My parents technically eat a plant-based diet as vegetarians, and it looks a lot different than my plant-based diet. So I think work with your parents to adapt your cultural foods and things that are part of your family story to make them healthier, to carry them to the next generation.
So I'm sorry, I'm still laughing at what Gaia said because it resonates with me. Telling my mom not to eat white rice, she looked at me like. So I had to walk away because I thought the next thing that was coming, I wouldn't like it. So. But what is my one thing? And you guys know I can just keep talking, but I won't. What I really want you to know is to understand your why. Advocate for yourself. Advocacy is not confrontational. Advocacy can be humbling and inquisitive. And don't leave a doctor without knowing your why. You've been shortchanged. Because when you go to the other doctor, guess what? If they didn't tell you that why, you get another one. And by the time I look at your chart, you've seen 3 doctors who are like, by the time I walk in there, know your why. Advocate for yourself. And the other thing I wanted to share with you is we do some things for women during February month. So we talk about prevention on National Go Red Day. It's where it's a free event where we just talk about the cardiologists. You get cardiologists coming to you live with free advice, just giving those things. We really want to see you guys, so that will help you also understand your why. Bring your daughters, your mom. We talk about that, but I will leave you with, whenever you're told there's something wrong with your health, not the why on Google, the conversation with your provider, the why. Humble and inquisitive.
I hope we feel, sometimes we can be a little overwhelming, but I hope we managed to empower you today. And honestly, I don't think anybody could have said it better than Dr. Randolph. I mean, she is incredible. I think the whole idea behind reset is probably the best thing I can leave you with. And in that, take time for, as a new mom, I feel this all the time, but take time for yourself and don't feel guilty about it, because that really does improve your mental health, and mental health at the end of the day impacts every form of disease state. So mental health matters, and take time for yourself.
It's a great one. I'd like to challenge everyone here today, because you've heard a lot of great things, a lot of reasons, a lot of ways to improve your health. Choose one thing. Maybe instead of 2 glasses of wine, have 1 glass of wine for the next year. Do something for yourself. One thing. Walk up the stairs for the next year, and then come back and talk to us about, or see your doctor and tell your doctor what you're doing, and see what improvement that makes. One small improvement, and dedicate yourself to one small thing, and you can really, really improve your health. And then when you get to that point where, okay, I did this for a whole year, choose another one. And that's how small increments of change will really change your life. And I encourage you all to do that.
Thank you. So I'll close just by saying, I'll close on something that Dr. Randolph said this morning. She said, we are the heartbeat. We are the heartbeat of our homes, of our organizations, and of our community. And you just heard all these women tell you how to take care of your heart. So make sure you take care of yourselves 42 million times a year and then some. Thank you all. Thank you. Please join me in thanking our panel. It's been an absolute pleasure. Thank you, ladies, so much for being with us all. And I'll turn it back over to Kim. Come on up.
All right, we're almost there. And hasn't the weather just held out for us? I am so impressed that we're just now getting a little warm, so it's great. Want to thank Lisa for an incredible job moderating. Thank you, Lisa. And also want to thank our esteemed panel. Again, they did an amazing job. I'm walking away with a lot of things. Be an advocate, take my medication, reset. Help my parents. Lots of great things we got out of today. And I also want to thank everyone on Zoom. Hope you were able to join us for part 2. And we appreciate you being a part of it. And thank you all in the room. Now just a couple of housekeeping items. What we're going to do next is we're going to move over to Margaritaville next. We're going to have some heart healthy apps and a great conversation and some additional networking. Also, there is an opportunity to do a behind the scenes tour of our CBS production truck that really they tell you a lot about how they bring this whole tournament to life for television viewers. So it's really interesting. So if you want to do that, you can do that as well. But let's move forward and go to Margaritaville. And again, thank you to Cone Health and everyone for joining us today. It was amazing. Thank you.